Okay, let's talk about a problem at the very heart of American healthcare. It's a problem so big, it costs us $1.5 trillion every single year. That's not a typo. To put it in perspective, that's more than the entire economy of Canada. We're going to break down what this massive disconnect is, why on earth it exists, and most importantly, how it's finally getting fixed.
So let's just start with one completely absurd number, 9 billion. That is the number of faxes, yes, faxes, that are still sent within the US healthcare system every year. Think about that. We're in an age of artificial intelligence, and the most important information about our health is being sent on technology from the 1980s. This isn't just inefficient, it is genuinely dangerous.
And believe me, this isn't some abstract issue. This is George. He's a 78-year-old Navy retiree with congestive heart failure. His doctor ordered a defibrillator that would literally save his life. But George had 4 different insurance plans, and he got trapped in this bureaucratic nightmare of faxes and phone calls. And while he was waiting for all those approvals, George collapsed. His story isn't some rare exception. It's a tragedy that's built right into the DNA of the system.
So how did we even get here? I mean, how did we build a system that depends on billions of faxes and puts people like George in real danger? Well, it all boils down to a really basic design flaw. Our healthcare system operates on 3 separate digital islands that just cannot talk to each other.
So first up, you've got the clinical island. And honestly, this part is pretty good. 96% of our doctors and hospitals use modern electronic health records. All your medical history, your lab results, your diagnoses, it's all there, it's digital, it's ready to go.
But then, you have the administrative island. This is where the insurance companies live. And their systems? They're basically running on technology from decades ago, built to just process claims. They have absolutely no standard way to read those modern medical records.
And that leaves the third island, the one we all get stuck on, the consumer island. As patients, we are completely cut off from this whole process. You can't see the status of your approvals, you can't figure out your coverage, and you definitely have no idea what something's going to cost until that surprise bill shows up in the mail weeks or even months later.
So what happens when these 3 islands can't communicate? Well, the only bridge between them is the fax machine. And that rusty old bridge leads directly to week-long delays for life-saving care, incredibly high rates of claim denials, doctors buried in paperwork, and yeah, that staggering $1.5 trillion in total waste year after year. Now, you're probably thinking, this is such a huge, obvious problem. Why hasn't anybody fixed it? And that's a fair question. The thing is, people have tried for decades. But all those efforts were like 3 separate quests, where each one found a critical piece of the puzzle, but nobody could ever find the whole picture. First, you had Avenir Health. They built the administrative processing platform, the pipes, but it was missing the clinical data. Then you had Health Data Utilities, which got hospitals to share clinical data, but they had no way to process transactions, no real business model. And finally, you had Smart Health, which made a great platform for consumers, but it had no data pipelines to plug into. You see the pattern here, right? Each one had a key piece, but none of them had all 3. And this brings us to the breakthrough moment. What if you could just combine all 3 of those pieces into a single, unified hub, a solution that finally connects the clinical, the administrative, and the consumer islands all at once? So here's the formula. It's actually pretty simple. You take that proven admin platform from the first attempt, you plug it into the statewide clinical data networks from the second attempt, and you wrap the whole thing in the neutral, trusted governance that the third attempt pioneered. And all of a sudden, they're the essential ingredients for the solution. The easiest way to think about this is like Visa for healthcare. Visa doesn't belong to your bank, and it doesn't belong to the store you're shopping at. It's the neutral utility that everybody trusts to connect them so a transaction can happen. This new hub does the exact same thing for healthcare. It's one single, trusted network that lets doctors, insurers, and you, the patient, all connect and transact in real time. Okay, so we have the solution. But why now? What makes this moment the one where it's finally going to happen? Well, it turns out we're smack in the middle of a perfect storm for change, and it's being driven by 3 really powerful forces that are all coming together at once. First, you've got the motivation. States are facing huge budget crises, and making the system more efficient is really their only good option. Second, you've got the means. For the first time ever, there's actual federal funding available to build this new infrastructure. And third, you've got the deadline. A federal mandate is forcing everyone to switch to electronic systems by January 2027. The clock is officially ticking. These 3 things, the financial pressure, the government money, and that hard deadline from the feds, they're creating unstoppable momentum.
This change isn't a nice-to-have anymore. For hospitals, for insurers, for state governments, it's become an absolute necessity to survive.
So, we know this is coming, but let's get down to it. What does this huge systemic change actually mean for you, for your family? Well, it means we're about to go from a world of frustrating, anxious delays to one of real-time clarity.
Just look at the difference here. Today, you might wait weeks for a critical approval for a procedure. With this unified hub, that approval can happen in 30 seconds because your insurance company can finally see the relevant medical info instantly. Instead of those awful surprise bills, you get real-time cost estimates. And instead of your doctor wasting hours on paperwork, they can spend that time focused on your care. This creates a totally new patient experience. I mean, imagine a single app on your phone where you can see all your coverage, track every authorization, and know the price of care before you get it. This puts you back in the driver's seat. You finally get to be in control of your own healthcare journey.
You see, that $1.5 trillion disconnect, it was never about a lack of technology on one island or the other. It was always about the lack of a bridge between them. And by finally building that bridge, we're not just getting rid of faxes and waste, we're creating a system where information flows instantly, a system that frees up doctors to actually heal and empowers patients to live healthier lives. The question really isn't if this will happen anymore, it's what other amazing things become possible once everyone in healthcare can finally speak the same language.